In 1948, it was revolutionary.
This leaflet is coming through your letterbox one day soon.
Healthcare free to everyone at the point of delivery, based on clinical need, not ability to pay. Arguably, no other single advance has done as much to improve the lives of British people. The NHS now has a budget 16 times bigger, but how healthy is it at 65? This doctor has set up a political party to oppose the government's recent reforms. He says the massive shake-up last April will eventually destroy Britain's most valued institution.
What we're seeing is a privatisation process by stealth. We're seeing more and more private companies deliver care, but it's being delivered under the NHS logo. So patients, when they go for care, think they're getting NHS care, but it's being delivered by private companies. That money is then going to those private companies and their shareholders instead of being recirculated in the NHS and going to frontline care.
Labour says what should have been a continuation of the celebrations at the Olympics is now overshadowed by a real sense of worry. And the Royal College of GPs says rolling back some reforms is the only way to make sure the NHS reaches 75.
I have confidence that the NHS will still be here in 10 years' time, but only and only if we reverse some of the reforms that have been brought in the last few years.
Today, the government announced plans to give elderly patients with complex needs a named clinician responsible for their care at home. A good example, says the Health Secretary, of how government changes are taking the health service in the right direction.
We need to change the model of care so that we are as good at looking after people out of hospital as we are in hospital. And I think that's probably the single biggest change we need to make. And unless we do that, we will duck the challenge of how to make sure that Britain is a good country to grow old in. And I want us to make sure that we meet that challenge.
That challenge is a world away from those the NHS faced in 1948. The prognosis for its future depends on which specialist you consult. Catherine Jones, 5 News.